the process itself is exactly the same. We take a biopsy from the patient, create the thermo-responsive hydrogel as an extracellular matrix. We take cells from the peripheral blood, reprogram them into induced pluripotent stem cells, introduce the cells back into the matrix, and instead of differentiating them to neural tissue, we differentiate them to cardiac tissue. And again, we saw that the extracellular matrix changes its properties to become a cardiac support matrix. So the basic procedure is exactly the same. We can use either patches, in which the only disadvantage is that you need to open the chest in order to basically place the patch on the injured site. But we can also use injectable 3D tissue that we can actually inject directly into the injured site. And it, since it's a thermo-responsive hydrogel, it's solidified at 37 centigrade, and therefore it can be inserted in this way instead of the patches.